Hey everyone, Dr. James Carter here. Today we're going to talk about a topic that's incredibly important for anyone who is sexually active or even just curious about their health: chlamydia. Whether you've heard the name before or this is your first time learning about it, understanding chlamydia is a key step in taking control of your sexual health and well-being. So, let's break it down together in a way that's easy to understand and free of judgment. Chlamydia is a sexually transmitted infection, or STI, caused by a specific type of bacteria known as Chlamydia trachomatis. This tiny organism is invisible to the naked eye, but it can have a big impact on your health if left untreated. It's one of the most common STIs worldwide, affecting millions of people every year, regardless of age, gender, or background. In fact, chlamydia is especially common among young adults and teenagers, but it truly doesn't discriminate. Anyone who is sexually active can be at risk. The Centers for Disease Control and Prevention estimates that there are over 1.5 million new cases reported in the United States alone each year, and many more go undiagnosed. It's crucial to understand this infection because it can affect anyone who is sexually active, regardless of whether you're in a long-term relationship, dating, or have had only a single partner. Chlamydia doesn't care about your relationship status or your background. It's all about exposure and protection. The bacteria responsible for chlamydia are masters of disguise. They hide inside your body's cells, often going completely unnoticed by your immune system. This means that you might not feel sick or notice anything unusual, even if you're infected. This stealthy nature makes chlamydia a silent threat. Many people who have it don't experience any symptoms at all, which is why it's sometimes called a silent infection. But just because you don't feel anything doesn't mean it isn't causing harm. Left untreated, chlamydia can lead to serious health problems, including infertility and chronic pain. The bacteria can quietly multiply and spread, damaging reproductive organs over time. For women, this can mean pelvic inflammatory disease, which can cause long-term pain and even make it difficult to have children in the future. For men, it can lead to complications like epididymitis, which affects the tubes that carry sperm. That's why knowledge is power. By understanding what chlamydia is, how it spreads, and what you can do to protect yourself, you're already taking a huge step towards safeguarding your health. It's not about fear, it's about being informed and empowered to make the best choices for yourself and your partners. In this video, we'll cover everything you need to know: how common chlamydia is, how it spreads from person to person, what symptoms to look out for, and why regular testing is so important, even if you feel perfectly healthy. We'll also talk about treatment options and how you can protect yourself and others. The good news is that chlamydia is easy to cure once it's detected. With a simple course of antibiotics, most people make a full recovery and can get back to living their lives with confidence. Early detection and treatment are key, so don't be afraid to get tested or talk to your healthcare provider. We'll also address some common myths and misconceptions about chlamydia, because misinformation can be just as harmful as the infection itself. By separating fact from fiction, you'll be better equipped to make informed decisions and support those around you. So, let's work together to dispel the myths and focus on the facts. When you have accurate information, you can take charge of your sexual health and help others do the same. Remember, your sexual health is a vital part of your overall well-being. You deserve to have all the information you need to make choices that are right for you. Let's get started and empower ourselves with knowledge about chlamydia. Chlamydia is one of the most common sexually transmitted infections, not just in the United States but around the world. It affects people from all walks of life, regardless of background, gender, or where they live. In the US alone, chlamydia is so widespread that it's often called a silent epidemic, because so many people have it without even knowing. You might be surprised to learn just how many people are affected each year. Every year, millions of new chlamydia infections are reported, making it the most frequently reported bacterial STI in the country. In fact, the numbers are staggering. Chlamydia is diagnosed more often than any other reportable infectious disease in the United States. According to the Centers for Disease Control and Prevention, or CDC, there are over 1.6 million cases of chlamydia reported each year. But experts believe the real number is much higher, because many people never get tested or show any symptoms at all. In fact, it's estimated that for every reported case there could be several more that go undiagnosed. This is because chlamydia often doesn't cause noticeable symptoms, so people can carry and spread the infection without realizing it. Young people are especially vulnerable. Those between the ages of 15 and 24 are at the highest risk, and this age group accounts for nearly 2/3 of all new chlamydia infections in the United States. This means that if you're a teenager or a young adult, you're much more likely to encounter chlamydia than older adults. The reasons for this are complex, but they include both biological factors and social behaviors. For example, younger people may be more likely to have new or multiple sexual partners, and they might not always use condoms consistently. Biologically, the cells in the cervix of younger women are more susceptible to infection, which increases the risk even further. But it's important to remember that risk isn't just about age. Anyone who is sexually active can get chlamydia, regardless of how old they are. It's really about behaviors like having unprotected sex, not getting tested regularly, or having multiple partners that increase your chances. The good news is that using condoms every time you have sex can greatly reduce your risk of getting chlamydia. Condoms act as a barrier, helping to prevent the bacteria from spreading from one person to another. It's also important to know that having chlamydia once doesn't protect you from getting it again. Reinfection is common, especially if your partner hasn't been treated or if you have new partners. The only way to know for sure if you have chlamydia is to get tested. Testing is simple, quick, and usually painless, and it's the best way to protect your health and the health of your partners. That's why regular STI screening should be a normal part of your healthcare routine, just like getting a physical or going to the dentist. By staying informed and getting tested, you can take control of your sexual health and help stop the spread of chlamydia. Chlamydia is a common sexually transmitted infection, and understanding how it spreads is crucial for protecting yourself and others. The primary way chlamydia is transmitted is through sexual contact that involves the exchange of genital fluids. This means that any activity where these fluids are shared can potentially pass the infection from one person to another, even if there are no visible symptoms. Chlamydia can be spread through vaginal sex, anal sex, and oral sex. It doesn't matter if the sexual activity is between people of the same sex or different sexes. Anyone who is sexually active can be at risk. Even if penetration is brief or incomplete, the bacteria can still be transmitted. Using protection, like condoms or dental dams, can greatly reduce the risk, but it's important to remember that no method is 100% effective. Once inside the body, the bacteria can infect several areas, including the cervix in women, the urethra in both men and women, the rectum, and even the throat. This is why symptoms can vary, and sometimes people don't notice any signs at all. Regular testing is important, especially if you have new or multiple partners. There's a common misconception that sexually transmitted infections only spread through vaginal intercourse, but that's simply not true. Any sexual activity that involves contact with infected fluids can lead to transmission, regardless of the type of sex or the genders involved. It's important to know that chlamydia cannot be spread through everyday casual contact. Hugging, kissing, sharing food, or using the same toilet seat as someone with chlamydia will not put you at risk. The bacteria that cause chlamydia are fragile and cannot survive for long outside the human body. In fact, chlamydia bacteria die quickly when exposed to air or surfaces, so you don't have to worry about catching it from objects or public spaces. The infection requires direct contact with infected genital fluids to be transmitted. Another important way chlamydia can spread is from a pregnant mother to her baby during childbirth. If left untreated, this can cause serious health problems for the newborn, such as eye infections or pneumonia. That's why it's so important for pregnant women to get tested and treated if necessary. Prenatal care often includes routine screening for chlamydia and other infections. Early detection and treatment can prevent complications for both the mother and the baby, ensuring a healthier start to life. By understanding all the ways chlamydia can be transmitted, you can make informed choices about your sexual health. Practicing safe sex, getting regular checkups, and having open conversations with partners are key steps in preventing the spread of chlamydia and protecting yourself and those you care about. Chlamydia symptoms can be tricky as they often don't appear. When they do, they differ for men and women. Women might experience abnormal discharge, burning during urination, or pelvic pain. Men might notice discharge from the penis or pain during urination. Chlamydia can also infect the rectum and throat, often without symptoms. Any unusual symptoms should prompt a visit to a healthcare professional. Don't ignore these signs. Early detection is key. Chlamydia is often a silent infection with most people showing no symptoms. This allows it to spread easily as people don't realize they need testing. The bacteria hide from the immune system, preventing symptoms. This asymptomatic nature is why regular screening is crucial. Don't rely on symptoms to decide if you need testing. Regular testing is proactive and prevents serious health issues. It's about taking control of your health and protecting your partners. Testing is essential for detecting chlamydia, a silent infection. It's like a smoke detector for hidden health dangers. Regular testing protects your health by preventing long-term complications. It also protects your community by breaking the chain of transmission. The CDC recommends yearly testing for sexually active women under 25. Men, especially those with multiple partners, should also consider regular screening. Testing is a responsible health decision for anyone sexually active. Testing for chlamydia is simple, fast, and painless. The most common method is a urine test, which is quick and non-invasive. In some cases, a swab may be used to collect samples from the cervix, rectum, or throat. These samples are sent to a lab for a highly accurate NAAT test. Results are usually available within a few days. If positive, your doctor will guide you on treatment. The process is straightforward and private, ensuring effective health management. The good news is, chlamydia is completely curable. Treatment involves a simple course of antibiotics, either a single dose or a week-long regimen. It's crucial to follow your doctor's instructions and complete the medication. Abstain from sexual activity for at least 7 days after treatment. Ensure your partners are also treated to prevent reinfection. Open communication with your partner is key to successful treatment. Retesting after 3 months ensures the infection is gone. Prevention is the ultimate goal in managing chlamydia. Consistent condom use is the most effective prevention tool. Reducing the number of sexual partners lowers your risk. Being in a monogamous relationship with a tested partner is safest. Open communication about sexual health is crucial. Regular STI screenings are essential for sexually active individuals. Combine these strategies for a proactive approach to sexual well-being.